Um, Good afternoon, everybody. My name is Jesse Madison. I'm a student at Cleveland Chiropractic College, Kansas City. I'm also a student at LMU DeBusk College of Osteopathic Medicine. I'm here today to present to you the topic of stem cell therapy. What I did was I rummaged the internet for articles involving the use of stem cells for therapeutic means. What I focused on was clinical trials using adult stem cells and embryonic stem cells. And what I looked for was positive outcomes and negative outcomes. And not just the outcomes clinically that are relevant, I also want to know whether these therapies have proven to be safe. Based on current research, what I found is that adult stem cells are much more useful than embryonic stem cells. That may be in part due to the fact that the amount of embryonic stem cell clinical research that has happened on humans is minimal, almost non-existent. So we need to start with stem cells and what makes stem cells unique. Part of what makes stem cells unique is their origin. Stem cells are unlike any other cell in the human body. Human beings start out as just a small cluster of cells which divides. And as these cells divide, they differentiate. And basically, the magic behind stem cells is trying to explain what causes this one type of cell, which is a morula. We refer to this type of cell as totipotent. What gives these cells the potential to become every type of cell in our human body? The origin of stem cells, embryonic stem cells, are often collected as unused products of in vitro fertilization. They're also collected from fetuses. This topic is the cause of much debate, and we're just going to skirt that today. Adult stem cells are often collected from adult patients. They can be found in different parts in the human body. They can be found in the dental pulp. They can be found in heart muscle. Most muscle has cells called satellite cells, which is a type of stem cell that, upon massive trauma, can be stimulated to become new muscle cells. Another quality of stem cells that makes them unique is their divergence capacity. Their ability to expand into numerous types of different specialized cells. Renewal capacity is a term I use to define the ability of stem cells to be renewed in a culture over and over again, to produce adequate numbers for therapy. Stem cells have the ability to reproduce over and over and over again, almost limitless, which makes them very valuable for not just transplantation, but also studying as a type of cell. Maybe you guys have heard of Henrietta Lacks cells, HeLa cells. They've been around forever. It's a type of cell that they've been using to study cancer for years and years, and it's almost in every laboratory studying cancer in the world. It's been around for years. Stem cells, because of all of those unique factors, are a very attractive option as a type of therapy. Adult stem cells and embryonic stem cells are very different, and they have different qualities that make them either more useful or less useful. Embryonic stem cells have a number of challenges that we have to overcome in order to make them a useful type of cell for human therapy. One of these differences is their ability to diverge into all types of cells. Embryonic stem cells are what we call totipotent cells. They have the ability to become every type of cell in the human body, whereas adult stem cells vary in their ability or capacity to differentiate. Some cells come from your ectoderm, some cells come from your mesoderm, some cells come from your endoderm, and each of those cells has a specific set of tissues that it's able to transform into. In therapy, or in transplantation, in surgery, they're also very different. Embryonic stem cells, because they're often collected from a donor that is not the subject of the treatment, those cells will be markedly different in their surface characteristics, their molecular characteristics, meaning that once they're transplanted in maybe another human, they have the potential to incite an immune reaction. You won't see this so much in adult stem cells because adult stem cells are often collected from the patient that is going to be treated. That's called an autograft. The graft or the transplantation is coming from that person, their own cells, if you will. And another difference is success in clinical settings. We've had much more success with adult stem cells than we have embryonic stem cells. Control over differentiation is misunderstood in all types of stem cells. It's even more elusive in embryonic stem cells because their potential is so vast. They have to go through many more steps and changes and unique chemical interactions that cause these cells to differentiate. Stem cell challenges that we face are culturing techniques, origin of the beginning cells, the baseline cells that we choose to propagate in vitro, as well as control over differentiation. We have a hard time controlling the steps. For example, it's very tough to make an embryonic stem cell, an entire batch of embryonic stem cells, millions of cells, change into one particular type of cells. Often what you'll see is multiple lineages that arise from that particular mother cell. In vivo, when we inject these cells in the human body, we're often faced with the formation of tumors. We call that tumorigenesis. We also face immunogenicity problems with these cells as they're implanted. And in general, there's a lack of understanding as to the manipulation and control mechanisms of these cells. Stem cells, despite all their shortcomings, we believe we can overcome those and use them in the future to potentially treat a variety of different ailments and diseases. Well, I'm gonna categorize the two different type of treatments, I'm gonna categorize the potential of stem cells into two different types of treatments. Stem cells have the potential to repair, and stem cells have the potential to replace damaged and diseased tissue. When I talk about repair, I tend to use think of the term trophic factors. Trophic factors meaning chemicals secreted by these stem cells that will have an effect that nurtures damaged tissue to regrow and to repair itself. When I talk about replacement, I'm talking about the ability of these cells to implant into a particular damaged tissue. For example, if you have a heart attack, once they're injected in there, they will find a home and they will actually grow into new muscle cells or new organ cells or new tissue cells of whatever type. Current clinical trials today involve the use of stem cells to treat cardiac damage, cardiac events, spinal cord injuries, neurodegenerative diseases, macular degeneration, and a number of others. The list goes on. However, we're going to focus on cardiac issues, spinal cord injuries, as well as neurodegenerative disorders. I've seen some trials that involve the repair of cardiac tissue using bone marrow stem cells. I've also seen trials that have used cardiac-derived or cardiosphere-derived stem cells. And both of these have shown positive outcomes clinically. CDCs, or cardiosphere-derived stem cells, have actually shown the ability to decrease the amount of scar tissue, as well as increasing the amount of viable myocardium, meaning that after a cardiac event, because of our level of understanding with stem cells now, we've been able to repair these hearts to a point where they wouldn't have been able to reach just 10 years ago. These hearts beat stronger now. The ejection fraction has increased. Blood's flowing better. And these people have a much greater risk. These treated patients with these stem cells, both BMCs and CDCs, have shown clinical improvements, meaning the patients often don't come back in for the treatment of a secondary event. Spinal cord injuries, this is really amazing.